giving a gift card to your new friend for Christmas.
Good morning, Jeff. How are you this morning?
There you are. How you doing, Linda?
I'm good. I just put a little bouncy music on, you know, to get them all hepped up for you.
Nice work. Yeah, that looked like on Hawaii.
Yeah, I think the guy's he's Samoan, I believe, but I believe he's from Hawaii. He's pretty popular among the younger reggae lovers, you know. He's not old school like what I usually force them into listening to.
Oh, okay. Yeah, that looked like Makaha.
I did it. I don't know too much about Hawaii. I've only been to the main island. So we've got 30 students or 29 students in this class, so they're still populating a little bit. I'd say give them a minute or two. Is that okay with you?
Absolutely.
You've been doing okay?
Incredibly busy, but yeah, really, really well. Thanks for asking.
Good. You got big plans for tonight?
It's my son's birthday, so yeah, we're taking him out and showing him a good time.
Well, good, good. So that'll be a fun thing. How old is your son?
He's turning 28.
Oh my goodness. He's an adult.
He is, yeah, no kidding. He reminds me all
time
the time.
fly. I know there's a commercial on TV now where it shows this guy. I think it's for one of the insurance companies, car insurance or somebody. It shows him racing to the hospital with his pregnant wife, and then it shows him teaching the kid how to drive, and then it shows him something else, you know, like they're in old age. And so that just about does fly that fast, you know.
Sure does. It absolutely does. You don't realize it until you actually go through it. You know, I remember it seems like yesterday I was his age.
Right. I know. Where does the time go? You know, and we look in the mirror and we still feel that age, you know. Like somebody's played a horrible trick on us. Wow.
Can you allow me to share my screen and I'll just
absolutely. Absolutely. Let me come over here and okay, you should be able to now.
All right, cool. And you know, while we're waiting, if you could kind of give me an overview of the class, and is this an undergraduate class, and you know, what is the subject matter and some of the stuff that you're currently studying, that kind of thing?
Okay, it is an undergraduate class and it is marketing. It's actually the undergraduate version of what the marketing class you used to do for me, the graduate level. And cool. So it's basically the same program, the same class, just the books are not quite as intense, you know, not as much in depth.
Gotcha. No, that sounds great.
So, okay, we've got 25 here now, so I'll just let them in as they pop in. If you want to get started, let me introduce you. Class, this is Jeff Pratt, and he is the CEO of Speedtrack. This is a wonderful piece of software that I want all of y'all to know about because many of you will have the good fortune of being able to work with it once you get out of the hospital. Graduate and go into the hospitals or some of the other healthcare facilities. Jeff, these students most of them are in their either almost at the end of their third year or already in their fourth year.
Fantastic. Well, thank you, Linda. I always appreciate the opportunity to meet with classes, both graduate and undergraduate classes. I've actually been working with Cal State Long Beach for a number of years doing presentations like what I'm going to do for you today. But for the first time, we're going to be incorporating Speedtrack as part of the curriculum in the spring semester next year. So very excited about that. It'll give students an opportunity to actually use the software to work on case studies, some of which I'll walk through today. A little bit about the company. We're a technology company. We've built some products using our technology, but principally we've invented a new approach to information technology, essentially, where instead of focusing on the data and how to store the data in some kind of a database so you can query the data. What we've done is we actually store the information that can be derived from the data. And I won't get too technical, but essentially what that means is our software automatically recognizes the associations between data elements, and it's those associations that we store. So we'll get into that in a little bit more detail when we walk through the demonstration. Normally, when I do this in person, I ask folks to raise their hands when I ask various questions, but obviously I won't do that today. I kind of take a census of the class. How many are currently in healthcare? How many are currently working in IT? That kind of stuff. But virtual meetings don't really, I mean, you can do it, but it's not the greatest way to do it. So I'll just forego that from today. But please don't hesitate to raise your hands using the Zoom meeting. And I will stop periodically and give folks an opportunity to ask questions. So please don't be shy. This is really about you. I like to make it interactive. It makes it more fun for me as well. So unless there's any questions at the moment, I'll go ahead and get started. Does anybody have any upfront questions before I jump in? Cool. And just feel free to use your chat if there's something you want to ask. All right. I'm assuming you can see my screen. It's just a placeholder, but let me bring up the application. And so this is what the application looks like. Let me describe what it is you're looking at, and then I can run through some demonstrations of what its capabilities are. So essentially what this is, and this is all fictional data, but obviously the products we create are using real patient data. And so just to get started, if you can follow my cursor down in the lower left-hand corner, this application is hosting over 90 million patient encounters. And then
Jeff, we're only seeing the first screen, I don't know if the one, your lead screen, population health decision support.
Got it. Okay, let me do this. Zoom's kind of funny that way sometimes.
Yeah, it definitely is.
All right,
I have the same issues.
All right, can you see it now? Thanks for letting me know, Linda. Sometimes they go.
Yeah, we can see it now.
All right, cool. So what you're looking at here is, again, down in the lower left-hand corner, you see over 90 million, and that's the total number of patient encounters. It says search results. So we start out looking at all the encounters. And up here at the top, where it says record type, there's an ambulatory surgery data set. It's got about 10.5 million patient encounters in it. There's an ER data set with over 61 million patient encounters in it. And there's an inpatient data set with over 18.5 million patient encounters. And if I sum these three numbers, they equal the total search results down in the lower left-hand corner. So essentially where this data comes from, and again, we've taken the data and completely fictionalized it. None of the information is in here is for real patients, but it gives you the same feel as if they were real patient records. But essentially where the data comes from in our production application is the state of California. By law, every hospital in the state, every state licensed hospital, I should say, which is 99.9% of the hospitals, have to submit their patient encounter data every quarter for the ER and ambulatory surgery data, and every 6 months for the inpatient data. And so what we've done is we've taken all that information from the state and we've integrated it with other data sets to increase the value of the information from that data. And we've put it in this platform. So again, to show you here, I'm currently in what's called the market share dashboard. We have a dashboard for patients, and this provides the sex, race, ethnicity of the patient and age ranges. MSDRG dashboard. If you're not familiar with MSDRGs, this is how hospitals characterize patient encounters to get reimbursed by the insurance agencies. So what they do is they have what's called a grouper, or a computer algorithm that looks at the diagnoses and procedures that were done for each patient. And then they apply a category, for example, normal newborns, psychoses, septicemia, et cetera. And here is the actual MSDRG codes, of course, associated with each description. And then down here, we've actually rolled up all of the service lines, or all of the MSDRGs, into one of 16 service lines. So if I want to look at orthopedics, for example, If I click on that, it shows all the DRGs. There's 112 of them associated with orthopedics, and you can see things like major hip and knee, medical back problems, hip and femur procedures, etc. And you can see over here that the subservice lines are joint replacement, spine fusion, etc., associated with orthopedics. And there are malignancies also associated with some, like bone cancers. And so the first experience a user has is they have complete visibility to every field and every data element in every field just by clicking on these tabs. And I'm not going to go into detail in terms of each tab. They're pretty self-explanatory. For example, in the trend tab, I can see that there was a big decline in patient encounters in 2020. And obviously, this is the result of COVID. So we've included that into the modeling for this fictional data. So it's as realistic as possible. So again, the first experience a user has is you have complete visibility over 90 million patient encounters and every data value that's associated with each of these patient encounters. And so you'll notice, for example, we call these groups or categories. Here's a facility name category. I can see there's 496 of 496 facilities in this list. And then the column next to each category shows the number of patients associated with each of the values in the category. So for example, LA County USC Medical Center had 770,000 patient encounters over this 5-year period of time. So again, just by looking at the interfaces, I can see information. But what really makes it powerful is it's literally a GPS navigation system for your information space. So if you consider these databases your information space, I can navigate through the information, continuously being guided to what's most relevant. So I can start anywhere. Let me give a couple examples. If I want to start with the hospital, and I'll just pick one at random here, let's say Riverside Community Hospital, I see that they've had 647,000 patient encounters over the 5 years. If I click on Riverside Community, the whole information space changed to reflect back all the remaining information. So it's guiding me through the information. The city that's had the greatest number of patient encounters for this hospital is Riverside, followed by Rubidoux, et cetera, Moreno Valley. And so that's information. And here's the zip codes in descending order that those patients came from. And of course, the counties they live in, 87% are in Riverside, another 7% are from San Bernardino, which makes sense. And then the second row here shows me the type of insurance they have. So let me continue the exploration just to give you a quick idea how powerful this is. If I want to pick a year, like let's go to 2020. And let's pick a few zip codes just to identify the geographic area that this hospital serves. Because these are sorted in descending order of frequency, I know that this is the #1 zip code that these patients come from. Before I do that, let's refine it a little bit and just look at inpatients. So I'm looking at Riverside County Hospital. You can see up here in this box, Riverside Community Hospital, for patients that were discharged in 2020 for inpatients. Now I'm going to pick, let's just pick the top, 7 or 8 oops. Let me clear that. I didn't mean to pick there. I meant to start at the top. Let's pick the top 7 or 8 zip codes. And so I've identified this geographic area for this hospital. I can see the breakdown by the type of insurance they have, whether it's managed care, and if it is managed care, what the payer plan is associated with that managed care. And if I want to do a map of this information, just to get an idea what it looks like geospatially, I can click on the map button. It's going to render these 12,378 patient encounters, and it's going to put it in a Google map. Why is it doing that? Never seen that before. Oh, here it is. Here's the map. There we go. So you can see here's the hospital. Here's those zip codes, and it's currently color coded to show me the patient encounters per 1,000 population for each zip code. Okay, so red being the highest density per population, blue being the lowest. But if I want to change it to the total number of patients from each zip code, I can do that. You can see how the colors change. So the zip code with the highest number of total patients is this zip code here, 92509. And the reason this is important when you're doing marketing or strategic planning is you can focus your marketing into these zip codes where the majority of your patients come from, or focus on the zip codes where you're not drawing patients from and try to get more patients from those. So let's take an example. Let's change this up a little bit and say that I want to grow my orthopedic service line business. So I'll go back to the application and I'll come over here to the MSDRG dashboard like I showed you a moment ago. And I can just come down and I can click on orthopedics. And so we'll do two things. First thing I'm going to do is look at the orthopedic patients that are going to the hospital that I've selected, Riverside Community. So I'll map that and I can actually see the zip codes that they're principally coming from here. So that'll be reflected on the map. And then I'll do something a little bit different. I'll see what other hospitals these patients are going to for orthopedics, so I can tell who the competition is for this geographic area. So you can see that the majority of orthopedic patients are coming from this zip code, while the majority of the overall patients were coming from this zip code up here. And now if I go back, and all I have to do is clear Riverside Community Hospital, and it'll show me all the other hospitals that had orthopedic patients from this zip code. I can see Riverside Community still has the majority of the market at 31%. The second hospital is Doctors Hospital in Riverside, followed by Riverside University Health System. So I can really quickly identify where some of these patients are going and in what zip codes they're coming from. So for example, if I wanted to look at Doctors Hospital, I can do the map again and see what zip codes they're coming from. And you can see how quickly it allows you to do this, to actually move through and do analytics in a geospatial way. And I'm going to look at totals here because there wasn't enough. Excuse me, my dog is in the background. The pleasures of virtual meetings. Hey, knock it down. So you can see how quickly I can do these types of analytics. Is there any questions before I show you one other thing with regard to mapping and strategic planning? Let me see here. Do I have any chats? Or Linda, if you have any questions you want to ask, that would be.
Yeah, the one thing, if you could kind of emphasize to them how important this is in planning, because like I said, these are undergraduates, most of them have not been in the hospital setting yet. So, if you could just kind of tell them what this might be used for as far as strategic planning.
Yeah, absolutely. It's used for a number of things in addition to strategic planning. So if you can tell, for example, another analysis that I can show you in a minute, but it's basically the same type of procedure, is a hospital can look at where their ED patients are by age and type of payer mix they have or insurance that they have. And they can use that as an opportunity to say, listen, let's put a clinic over in this area because a lot of these patients are coming to our emergency department for issues that could be handled by a primary care physician. If we had an urgent care, some kind of clinic over there, it'll keep our ED from getting overutilized and provide better care for that segment of the community. That's one thing that we can do. Another thing we can do is for strategic planning and marketing and those kind of things, is you can understand geographically how you compare with other hospitals. So if there's another hospital that's doing a majority of patients for, let's say, Medicare for a particular service line or procedure, and you want to grab some of that market share, you know that you have to get some contracts from Medicare and start doing more marketing to the docs and maybe bring some docs into the hospital to start doing like orthopedic procedures, to start attracting some of those patients to your hospital. So it gives you insight in the kind of things you need to do to bring patients that are looking for various procedures from various geographic locations into your hospital going forward. You might have to make a capital investment for some new equipment, like robotics or something, to do those types of procedures. And like I said, you might have to recruit different specialists to come to your hospital. So a quick story, I was actually got a call from a hospital CEO a while back, and he says, "Hey, Jeff, I'm sitting here with a cardiac surgeon, and I'm trying to recruit him to the hospital. And he asked me, what is the annual number of patients that we do cardiac procedures on, or the total market actually for cardiac procedures from their primary service area, the zip codes that make up the surrounding community." He said, "How many per year are we doing?" He's asking me. So I had the answer within less than a minute. And so he sat down with the cardiac surgeon and, told him that, yeah, this is the data, and clearly it's enough to support your practice at our hospital. So that's just kind of an overview of the types of things and analytics that this platform supports. Are there any other questions from either the students or from Linda?
I have a question.
Sure. Is that Thelma?
Yes, it's Thelma. So you're talking about how all of this data is gathered. Where does the data actually come from, and what makes this system and software so revolutionary for the medical industry or the healthcare industry?
Sure, great questions. The data actually comes from the hospitals. So like I said, by law, they have to submit it to the state of California. And Speedtrack actually has a partnership with the Hospital Quality Institute. They have a platform for analyzing hospital quality that actually Speedtrack built for them. And they have a relationship with the state and with the California hospitals, where the hospitals are actually uploading the data directly to HQI, or the Hospital Quality Institute, on a quarterly basis, and Speedtrack gets it at the same time. So that's the source of the data. In terms of what makes the technology so revolutionary is the fact that we actually invented this method for analyzing and navigating through information. We have several patents on it. So that's what makes it revolutionary. And like other systems, the Speedtrack system obviously is very fast, and it's also very intuitive. So you don't have to be an IT person to use it. You just have to have a little bit of training and know how to click a mouse, and you can do incredibly complex analytics. What I've showed you so far is really simple. But in a moment, I'll show you something more complex. I'll show you a couple things that are actually more complex. Does that answer your question, Thelma, or do you have a follow-up?
No, that's great. Thank you.
You're welcome. Anyone else have any questions before I go a little bit further?
One other question, Jeff. You said y'all get the data. This I know that y'all created this database just for us for the school, but the real-time data, you get it like 1 quarter behind, or how current is the data that you are looking at any given time?
Yeah, it really depends on the hospital and how often they want to upload. So, some hospitals are uploading every day. And it takes us a couple days to process it and get it into the system. So other hospitals are only updating it once a quarter. And not all the hospitals in California are participating in that project with HQI. We're trying to get them all participating. But for those that don't, we have all the historic data for them that we get once a year from the state of California. Some regions, for example, Riverside and San Bernardino, all of their hospitals are participating. So we got very good coverage in that area. San Diego has other really good coverage. So we're trying to expand that throughout the state. But even for hospitals that aren't uploading their data frequently, they get value out of the system. And by the way, we have through 2021 in our production system. But like I said, this is fictional data for HIPAA reasons, for privacy reasons. But for a real production system, we have through 2021, and for the hospitals that are participating, we have through the 3rd quarter of 2022. So it's still very valuable for hospitals to get, because the demographics and the patterns for hospital utilization don't change that fast, right, over time. So even if they can see at least the 2021 data and what their market share was in the types of analytics that I just showed you, it's still very valuable for them.
Okay, so one other question, then I'll let you move on. I know
Sure.
that when you came and visited my grad classes, you said that the hospitals pay a fee to have access to this data. Is that correct? Is like not every hospital has access, correct?
That's correct. So for the Speedtrack platform, it's an annual subscription model. And it's driven by, the cost is driven by the number of patient encounters for each hospital, but it's still very affordable, especially when you compare it to our competitors. It's half the price or a little bit less, which we can afford to do because our system is so efficient. It doesn't cost us that much to process the data and host it in our system because it doesn't use much CPU. So that's the reason for that. But having said that, all the hospitals in California have access to the hospital quality institutes because that's part of the benefit of being a member of that California Hospital Association. And all the hospitals in California are a member of the California Hospital Association. So they get that benefit for free. But to have the robust analytics and capabilities that I'm showing you here in this application, yeah, there's an annual fee associated with it.
Okay, and you had
So
one
is
question
this-
in the chat, but I think kind of got answered just now. Did you, the one from Ashley?
Yeah, somebody, is that Ashley that was just trying to talk?
No, it's Thelma. I had another question. Is this only available for California hospitals or is this more nationwide?
Yeah, this particular application that I'm showing you here is just a California application, but we have other applications that are national in scope. And let me see, I'm looking at the chat. Is this data easily accessible by providers and future users, or do providers and users have to ask permission? It's easily accessible, but like I said, it's well, let me answer your question this way. Any hospital in California can get their hands on the data for free. If they're a licensed California hospital, they just have to give a request to the state of California and go through an approval process, and the state gives it to any licensed hospital or county health department or research group, nonprofit research groups for free. The issue is once they get it, you know, typically they'll try to put it into a database, but it's really not that usable for non-technical people. So the way that works, if it's in a typical database, is unless you're technical and know how to write, you know, SQL queries to a database, it's not really accessible. And then even if you do know how to write queries to a database, you don't get the experience of discovery that Speedtrack provides you. You have to think of, okay, what's the query I want to write for Doctors Hospital of Riverside? And then you write that query and, you know, then you get the information back and you say, okay, what are the top 7 zip codes associated with? And then you have to write another query where I can just click through and see what the top 7 zip codes are and get the information in a matter of seconds. And then I can, it creates additional questions that say, well, Medicare is the top insurer. What does that look like? And I can just drill in and, you know, and zoom in and out. Let's say I wanted to do the same query that I have here. So it's these zip codes for Medicare for 2020 orthopedics. Let's say I wanted to do this same query, but for, you know, a completely different hospital. Let's say I want to see what patients from these zip codes are going out of Riverside, are going to hospitals outside of Riverside County. I can just come up here, open up my window for facility stuff, go to facility county, and I can see there's only 39 from those zip codes for orthopedics in 2020 that went to Los Angeles hospitals. Now, if I was just using a database and writing queries against it, that would take me a long time to get that information. So that is the benefit of using our system. It literally saves hours and hours of analysts' time. In fact, CEOs, CFOs, even Linda could use this. So let me see.
Thanks a lot. I appreciate your vote of confidence.
Yeah, well, absolutely. I think you probably could. You mentioned this was, do you get requests from insurance companies for subscriptions to this data? Absolutely. We get requests from all kinds of folks, not only insurance companies, but like device manufacturers and people that provide, artificial knees and stuff like that for hospitals, because they want to see what the volume is and the market share is and all that kind of stuff. Unfortunately for them, because of the arrangements with the state, we can only provide this data to hospitals, county health departments, and research organizations. Having said that, we have other applications that ingest claims data. So when a provider makes a claim, we get that information, whether it's a hospital, primary care provider, an ambulatory surgery center, a skilled nursing facility, any place a claim is created, it goes into our system, and we can see wherever those patients had service anywhere in the United States. So that's very powerful. That's used by insurance companies and hospital systems, as well as provider networks. So great question. Any other questions before I move on? Okay, real quickly, this was inpatient, so let's do something with ED visits. I'm going to click start over. And I'm just making up these queries on the fly. So bear with me here. So let's say I want to see the impact of COVID on emergency departments in Los Angeles County in 2020. And again, this is fictional data, but we've statistically synthesized it so that it's directional or representative of things that actually happen in the communities. So let's look at 2020. I'll look at emergency room or emergency department encounters. So I've isolated all the encounters, and now I'll come over here to the diagnosis dashboard. And I want to isolate all the patients that had a COVID diagnosis. I can just come down here to classification, and I'll just start typing COVID. Coronavirus disease, 291,000 affected EDs in 2020. And I said, let's just look at EDs in LA County. I'll again open up the facility window, come over here to LA, click that. You can see the query LA County facilities for 2020 ER, and I'll widen this for coronavirus disease. And then I'll just come over here to the trend. And so here's the trend in, there weren't any prior to April of 2020. And then over here, I can see throughout the year, there was the first spike. And then later in the year, there was the second spike. It was in December. It was just off the hook, if you remember correctly. And now if I come over here to the ED market trends, this will take a moment to load, but it's going to show all the facilities in Los Angeles County it's going to show this trend, but because I only selected 2020, it's only going to show the data for 2020 because there wasn't any coronavirus prior to 2020. So these columns will be blank, but it'll show the volume for 2020 by hospital. And then down here, it's going to show the volume by the type of payer they were, by the age range, and social determinants of health, which if you're not familiar with social determinants, it is a diagnosis code that the hospitals are required starting in 2023 to code to indicate any social what they call determinants. It could be if they're homeless or if they have food insecurity, those kind of things. If they're in a hostile environment or they don't feel safe, it indicates those kind of things. But you see that wasn't really indicated for these patients. But you can see the volume. LA County USC Medical Center had the greatest volume of COVID patients throughout the year, followed by Kaiser Downey, Antelope Valley, et cetera. That's interesting that Antelope Valley was number 3, because that's really not a high population area, Pomona Valley, et cetera. So you get the idea how fast I did that. Is there any questions on this aspect of it before I go a little bit farther and show you a couple more in-depth analytics and predictive modeling we can do? And please keep me posted, Linda, on any people that raise their hands, because sometimes they get caught up in the application and don't look at them. The Zooms.
Sure.
So
I
let's do
think that if they would put a chat and, and let me know their hand is raised, because I can only see, the few that are on my screen. I don't have but one screen. So guys, if y'all have something to say and I'm not seeing your hand, put a chat in there. Hey, I've got my hand up.
or don't hesitate to interrupt too. I mean, this is for you guys. So if it's easier for just to unmute and ask a question, I'm cool with that too. That doesn't bother me at all. So let's go through one other quick analysis. Let's say I want to do a comparative analysis by hospital for the average length of stay for each patient, their average age, and the average cost associated with each patient. So let's run through that again. I'll pick a year. Let's do 2019 in this case, just to pick a different year. And so let's look at inpatients. And let's pick a particular service line. Does anybody have a service line they would like for me to zero in on out of this list here? And feel free to unmute and call out if you like.
I'm surprised. This is not usually a quiet bunch.
Yeah, well, I'm intimidating.
I guess that's what it is.
Well, I'll just pick cardiac services, and we'll come back over here. And I want to do a comparative analysis. I'll just widen the category here with my mouse. And I want to add some columns here. So I click on the settings menu and I come down here to find a column. And I'll add a few columns. I said length of stay. And that's just, I type LOS for length of stay. There's the average length of stay. And if I'm only looking at 2019, but if I wanted to spread out the trend by year, I could click on each one of these as well. And when I click on it, it adds that column. And now it's calculating those average length of stay. But while it's doing that, I said average age. Down here is average age. Add that. And let's do cost. So I'll just type in cost. And here's average cost. I can do it by day or total cost, but let's just do average cost because that's going to be a little bit more meaningful. And for fun, let's do the distribution for the top 5 type or the top 3 types of insurance. So this is Medicare, or I mean inpatient, so I'll type IP. And so I'll do the percentage of Medi-Cal, percentage of Medicare, and I'll come down here and do the percentage of private coverage. You can see there's other things like other self-pays, but they make up a very small percentage. These are the 3 principal types of insurance. And so I've done this comparative analysis. I can sort on any column if I want to see who has the highest costs. Wow, Health Bridge, but they only had 2 patients. So that's an outlier. And so if I come down, you can see that the distribution kind of levels out. And if I want to do some, yeah, go ahead.
Brianne.
Yeah, thank you. My name is Brianne Bediumol. I was wondering, okay, so I was trying to see if you can make a difference with like a children's hospital if you just want to see that particular group versus 2.
Sure, let's do that. Right now I'm looking across the whole state of California. So I'll just type in children's. Here's the Children's Hospital in California. I'll just select all of them.
Oh, cool.
And it'll recalculate all the stuff. And then it'll take a couple seconds to do that because I'm going from 421,000 down here in the lower left-hand corner to just over 2,500. So yeah, here's that comparative analysis, and you can see the distribution by patient. And if I wanted to do some statistics and look at it by outliers, I can add z-scores, and red is more than 3 standard deviation, orange is between 2 and 3, blue is between 1 and 2, and if it's green, it's within 1 standard deviation. And if I want this report, I can just right click, copy it, bring up an Excel spreadsheet, and paste it right here in the spreadsheet.
Yeah, we can't see the spreadsheet.
Damn, this Zoom stuff isn't great. Okay, let me show you the spreadsheet. Thanks for letting me know.
Sure.
I'm going to see if I can.
One of the downfalls of Zoom, it doesn't.
Oh, you know what? There is a way
Yeah.
to do this, but for some reason it's not letting me. It's crazy. Oh, here it is. Show. No, that's not what I want to do. Anyway, let me show you the spreadsheet here real quick. Here it is. So you can see I pasted all that information here in the spreadsheet. I just have to format it a little bit.
And I'm sorry, while you're doing that, so you're saying that individuals who are in T have access to this, not, because I was seeing if I have access to it right now because I'm at work, but I don't see it.
No, you don't, but you will. We're just getting it set up on your, you guys have a virtual space that you can access that's provided by Cal State Long Beach. I can't remember what it's called.
She's actually at work though at a hospital, I believe.
Oh, what hospital do you work at?
Oh, so I work at Children's Hospital of Orange County. I'm in the
Oh.
corporate compliance department. So seeing this and having access is definitely beneficial. And I was just curious if I have access to it right now, so I could just like play around with it.
You don't right now, but I'd certainly love to give you access. In fact, I would give you a trial for a period of time if you're interested. I'll bring up my phone number at the end of this and my address. So please feel free to reach out.
Okay.
And we can work that out.
Yay, thank you.
Of course. Yeah, no, thanks for the question. Any other questions on this type of analysis? And there's any number of things I can add here in terms of columns. There's 2 other things I want to do real quick. I want to show you how we can do, I think we have it in this, but we'll find out here in a second. I'll show you how I can do some forecasts and predictions on the fly. And then I'll show you how we can actually create some charts and graphs in Excel using the data associated with a query. So are there any other questions on what I just did before I move on? Okay, so I'm just going to go ahead and hide these columns since we've done with this. Oops, I don't want to add a new column, I want to hide it. Hide column. Okay, I'll just clear this whole thing, click start over. And let me do something completely different. Let's say let's pick up. Yeah, go ahead.
Jeff, we're still on the Excel sheet. If
Oh, yeah. Thank you. Damn it. All right, new share. You know, I do this all the time with my Zoom, but for some reason it's not allowing me to share this particular screen, regardless of which application I'm running. So anyway, sorry about the inconvenience. Well, let's do something different. Let's say I want to predict my ED volume for LA County Hospital. No, let's do Orange County to do something different for the next 3 years. So I'll just go ahead and open up my facility window again. Take Orange County. There's Orange County. Here's Orange County facilities. I'll narrow down to ED. And then I'll add, and I can add these columns to anything I wanted to, by the way. If I wanted to see the payer mix by zip code or average age within zip code or whatever I wanted to do, I can add it to any column. Diagnosis, DRGs. By the way, the reason DRGs are blank is because they don't apply to emergency room visits. They only apply to inpatient visits. So, okay, anyway, let's do a prediction. Volume of ED visits for Orange County facilities. I'll come down here again. I'll add a column and I'll just look for projections. And so I can do this a couple ways. I can either predict using the data from 16 to 19. So it'll predict, it won't have the information from it for 2020. So the reason that's cool is because 2020 is kind of an anomalous year because of COVID. Or I can pick from 2017 to 2020, which will include 2020, but I'm going to pick 2016 to 2019. So it's doing a projection for the year 2020, projections 2020. I'm going to do a projection for 2021, for 2022, 2023, and 2024. And so you can see the volume projections by hospital here. I'll just widen this. And so I can see which hospitals are expected to increase their ED volume. Actually, most of them, it looks like they're increasing. I don't see anybody here that's decreasing. Some of them are pretty much flat, like Mission in Mission Viejo. But the other thing I can do, if I want to change, if I want to just look at Medicaid patients, for example, these projections will update with the correlates, with the correlations associated with Medicaid patients. So now it's showing me the projections of ED visits in Orange County just associated with Medicaid patients. Or if I want to pick for children, let's do that. So I'll unclick Medicaid, or I could do it with Medicaid for children if I wanted to, but let's just do, under 1 year or 1 to 17 years, pediatrics essentially. And I'll see what those ED visits look like. Here's CHOC of Orange County right here. And so you can see CHOC children of Orange County went to the top here in terms of total volume. And so you can see that projection. So, we can do those kind of projections on the fly. Any questions on this before I move on to the final thing I wanted to show you guys?
I'm just curious. So if it says like CHOC Children's Hospital of Orange County, I know we're technically a health system now. So does that include as the involved clinics? Can we specify for that, or is it just the entirety of it?
It's just for the hospital in this case. But like I said, we have other applications where we can include clinics, physician groups, et cetera. Anybody that creates a claim, we can do that. It's another application we call PHDS, Population Health Decision Support. So happy to talk to you in more detail about that. Any other questions before I move on? Okay, cool. Let me again remove these columns. And what I'm going to do next is I'm going to pick a hospital and create a primary service area for that hospital. Let me pick something in Northern California just to move things around a little bit. Let's go up to Santa Clara, California. No, I've still got this other stuff selected, so let me unclick ED and ages. And I'm going to do something a little different here. I'm going to look at inpatient. And typically when we're doing strategic planning or marketing, we don't include normal newborns. And the reason for that, what is going on here? What do I have selected here? Let me start over again. All right, inpatient. Santa Clara, that's better. Okay, so when we go over here to the DRG dashboard, we remove normal newborns because a couple reasons. One is, if you think about it, there's only one admission, the mom, and then there's multiple discharges, the mom and her baby or babies. And not only that, but the newborns, the normal newborns really don't take up much, don't utilize much service in the hospital. They just kind of show up and leave, right? So, you know, and then become the dictator of your house. So we can remove that. If I right click on them, I can click on negate. Oops, negated the wrong thing. Let's negate normal newborns here. So if I click on it, right click on it and click negate, you'll see up here in the query box, it now says not normal newborns. So I'm looking at everything except normal newborns. And so let's pick a hospital. Let's pick El Camino Health, just to be a little bit different. And for fun, I'll just pick the top zip codes here and call this their primary service area. And so there's the primary service area for Santa Clara, just like we did before, inpatients. Now I'm going to unclick El Camino. I'm sorry, it was the primary service area for El Camino for this 5-year period of time. And so this is cool. I can kind of see that El Camino has a 40% market share, followed by Kaiser. But I'm going to create a series of charts and graphs in Excel. So I've got 103,000 patient encounters. And I'm gonna open up what we call a report template just by clicking this button here. And you can see we have a report chosen, and I can create other reports in here. I only have this one created for the Cal State Long Beach thing so far. But I can export these 103,000 patient encounters into a spreadsheet. So I'm going to click save. And now it's hitting our server in the cloud, and it's going to download these 103,000 patient encounters. It'll probably take a few seconds to do that. And then I'm going to open it in Excel and create a bunch of charts and graphs on the fly. So is there any questions while I'm waiting for this to update with the data? So while I'm waiting for that, one of the things I want to emphasize is what we've done is we've created a macro that fits into Excel, which all the students will have access to. And you'll be able to do exactly what I'm doing here for market analyses. And this is a really neat feature for our hospitals because executives can use it. Everybody knows how to click on a button in Excel. And I'll show you how that works here in a second. So there's the 103,000 patient encounters in this link. I'll click on it. Here it is in Excel. I'll open up this Excel.
And we can't see it.
Oh, son of a gun. Yeah, thanks again. I love this.
Jeff, which class are you working with? I think it's Nora Go-To is one of them, but
Yeah.
What numbers
I'm
are
gonna
they?
work with Nora. I'm working with, I'll work with Jim Lott. I don't know. I've lost track of everybody, to be honest with you.
Is it the research classes that you're doing it for? Because Jim Lott teaches this class, and then he also teaches a 300 and a research class,
You know,
400 level.
to be honest with you, I don't even know yet.
Okay, okay.
Have that set up for, like I said, next semester.
Right. And I think some of these students will be taking those classes. I can't remember exactly which numbers they are, but so y'all are kind of getting a preview of what's to come.
Yeah, so this is actually one of the case studies we're going to have for the class. So you'll be able to pick a hospital, or it might be assigned to you, I don't know. You'll identify the primary service area. You'll export this data into Excel like I just did. And then you'll have a macro in Excel. Here you see there's a Speedtrack tab. I just click on Speedtrack. I click on this icon for market share. It's running the Excel macro. And it's going to create a bunch of charts and graphs for me. So you don't even have to know how to do that in Excel. And I'll show you the end result here in a second. So it's processing that data. So here's the charts and graphs. If I scroll down,
We don't see them.
You can't see that either?
All we can see is the Excel worksheet.
Oh my God. Okay, let me, we got to figure this out, Linda. All right. So here's the Excel spreadsheet that it created now. It's a new Excel
There we go.
So if I scroll down, it created this market share pie chart, and it shows for 2020, which is the most recent year in the data that I exported. So you can see which hospitals had the greatest market share overall. And it shows the top 10 hospitals that had patients from that service area, and then all others. And then if I scroll down, it shows a volume trend by hospital, the top 10 hospitals and all others. So you can see El Camino dropped in 2020. Everybody pretty much dropped in 2020. Stanford was actually up because they're a teaching hospital. So they were probably taking on a lot of stuff that other hospitals wouldn't during that period of time. And then this is actually showing percentage of market share. This one up here shows the volume change. This one down here shows the percentage change. And then down here, we actually have a table with all that information for every hospital. Here's the top 10, but if I scroll down, it has the information for every hospital. The volume changes over time and the percent market share changes over time. But the neat thing about this is if I want to modify this by using a filter or a combination of filters, let's say I want to look at, Medicare patients. So I'll click on Medicare for, let's pick another service line here. Let's pick something different. General medicine, for example. And all these charts updated with that information. So you can see the two filters I created up here at the top. Now this is showing me those changes for all these hospitals over time. And I can put these charts and graphs into a Word document or a PowerPoint, whatever I want to do. And this is the kind of stuff we're going to be doing for casework next semester for students. You'll be given a case study for a hospital, you'll do the market share, and then you'll talk about, what you would do if you were going to put a marketing program or a strategic plan together for these hospitals. And that's what I have for today. Is there any final questions?
This was really great. And I could see how looking at these charts that an employee could really shine if they knew how to use this. I think this is a really great opportunity. I know I can see Brianne, she's probably thinking, well, I can pump out these charts. I'm going to be looking good.
Well, you know what? It's really gratifying for me. And I get incredible emails from people all over California that use our, and I'm not bragging, it just makes me really happy, all over California that use our systems on how it's not only increased the amount of analytics they can perform in a day, because CEOs and CFOs are always having questions, and COOs, and they can pop out, all kinds of reports in a few minutes that used to take them several days to create. But they're finding things that are really useful. It's not just getting the charts out, but they're finding information that changes how they're looking at their communities and what their strategic plans are. So I find that really gratifying, and I can't wait to get this in front of students and work with students on how to really utilize information and data so that you're really prepared when you get out in the real world, whether you're using Speedtrack or any of the other analytics programs, the kind of questions to ask and the type of analytics that you can create and add value for your employers. So that's the goal. I really appreciate everybody's time today. I hope you found this valuable.
Hang on just a second, Jeff. Let me ask Brianne, you had your mic off. She's actually one of my grad students that is an totally online class. And I invited them to come listen. And I think, Brianne, can you add anything to this being in that type of position?
So my position, I'm also like a data analytics for the corporate compliance side. And I mainly deal with like disclosures and breaches and so forth. So with this inpatient care, it gave me a different insight. I don't necessarily have a question, but this is more of like the filters. I guess you kind of showed it right there at your filters tab. And if I had a chance to if I don't like this particular data, am I able to still edit the data as since it's already on Excel? That's pretty much it.
Yeah, I'm not sure I understand. So when you say edit the data, do you mean actually go in and change the underlying data that's feeding the system, or?
I think she means more manipulate, right?
Oh yeah, you can absolutely, manipulate it, 7 ways from Sunday, any way you can think of. I mean, the only limitation is your imagination. So yeah, we try to make it as intuitive as possible for non-technical people to use. That's clearly our goal. I said I would put up my email. There it is on the screen. If you have additional questions, please don't hesitate to reach out. I'd be more than happy to answer them via email. And please don't hesitate. I've got to jump on another call here, guys.
Okay, just real quick, Jeff, can you check your calendar for 7 o'clock at night on the 8th? That's the last day I have open. And just kind of drop me an email and let me know, because if you can't do it, then I'm just going to show this recording to my class tonight. But if you can do it, you know, I'll flip the schedule around.
Yeah, you'll have an email before noon today. I think I
Okay,
probably
thank you
can.
so much.
That's the 8th.
The 8th,
Okay.
yeah.
And that's the 7 o'clock class.
That's the 7 o'clock class, yeah.
All right. Yeah, I'll get that to you. I think it's probably okay, but let me confirm it and I'll get back to you this morning.
Okay, I appreciate it. Thank you so much for spending time with us. And I know the students learned a lot and they have a lot to look forward to, because many of these students will be taking that class.
Awesome. I'm looking forward to it as well. Thanks, everybody. Bye-bye.
Okay, have a great day.
You too.